Hi, I'm Dr. Sarah Trunk from Balance Within Integrative Physical Therapy, and today we're going to talk about down there. We're going to talk about Kegels, also known as how to fire your pelvic floor properly. There's tons of research that shows that over half of women are doing these wrong, and that can cause all sorts of problems like prolapse issues or not having enough strength to really stabilize ourselves if we're running or trying to be really active in life, and it can even lead to problems like urinary leakage or pelvic pain too. So when we're doing a Kegel, we want to think about the four corners of our pelvic floor. So our pelvic floor is pretty much like a hammock, that whole area that we're sitting on. And you can think of the front of that diamond kind of shaped pelvic floor, the front part being the pubic bone, the back, the tailbone, and the two sides being our sit bones. So if you're sitting, you can really feel that whole area in contact with your chair. When you do a Kegel properly, you can think of bringing all four corners in and kind of up, almost like you're cinching a purse string. So one of the first big mistakes that people make is they might be actually pushing down or bulging down instead of gathering in and drawing up. So this is a great exercise. Like I said, you can do it in sitting, when you're driving, or even just throughout the day very easily to just help strengthen these muscles that are so important for us to function in all sorts of ways during our day. Now, when you're doing your Kegels, you want to shoot for working up to being able to do 10-second holds with these. So you'll do that gathering in and drawing up. And if you were to visualize kind of like a 10-story building and maybe an elevator, you want to just go from the basement to about the first or the second floor. So you don't have to go all the way up and max out that contraction. So just a gentle lift and hold and count to 10 seconds. And after those 10 seconds, you want to relax fully, come back to that basement. And that's really important because our muscles need to both squeeze or contract and relax. You don't want to train them to have too much tension because that can be sometimes a driver for pelvic pain. So that's the first part of it, where we want to get these muscles stronger and get their endurance to last a lot longer too, so they can support us basically anytime we're vertical by, helping to lift and support that whole trunk. The other piece to this is we also need these muscles to be quick enough. So if they're not quick enough, we can have issues like leakage when we jump or cough or sneeze. So anytime there's a quick downward pressure, those muscles have to be quick enough to make sure that there's no urine leaking out. So the other part to your Kegels will be you want to do 10 what's called quick flicks as well. So you're doing pretty much the same thing, but you're going on, off, on, off, on, off 10 times in a row. So that's usually one of the trickier ones. You want to start with just the 10-second holds first. Once you've kind of nailed those, then really try to train that quick, powerful contraction that can help you with, like I said, coughing and sneezing and jumping. But if you have any questions, I'm always here to answer them for you. So feel free to reach out. And of course, we do offer in-person visits and consults as well if you're really not sure if you're doing these correctly. So thanks so much for listening, and hopefully I'll get a chance to talk with you soon. Thanks.